Welcome, Dr. Joseph, sir.
என்னோட அக்காவுல கொடுத்தேன்.
We will wait for 2 more minutes, dear participants, and we will start the day's proceedings. Welcome Dr. Manju and Dr. Anaga for the event.
Thank you, doctor.
Dr. Hari Krishnan, shall we start the meeting now?
Yes, ma'am. Namaste, dear all doctors and participants. Today we have assembled here for the 4th edition of PRAGNYA 2026. This is the initiative from Heavenly Fuel Private Limited to mark the birth anniversary of our founder, Mr. Giridhar, who had himself succumbed to multiple sclerosis in 2015. His birthday falls on March 3rd, and in memory of that, today we are conducting this event. We start the day's proceedings with prayer by Mrs. Janani.
वक्रतुण्डमहाकाय कोटिसूर्यसमप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुः साक्षात् परब्रह्म तस्मै श्रीगुरवे नमः नमामि धन्वन्तरिमादिदेवं सुरासुरैः वन्दितपादपद्मं लोके जरारुग्भयमृत्युनाशं दातारमीशं विदिधौषधीनां सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः हरिः ॐ
Now I call upon our MD, Mrs. Lalita Venkatakrishnan, to deliver the welcome address.
Lata ma'am, you're on mute.
Namaste. Respected Ayurvedic doctors, distinguished guests and colleagues. It gives me immense pleasure inviting you all for the Pragnya 4, dedicating to my son V.S. Giridhar on his birthday, which falls on 3rd March. I am here today with a heart filled with both grief and a profound purpose. My son V.S. Giridhar, the visionary founder of Heavenly Fuel Private Limited, left us when he was 23 by a dreaded disease, multiple sclerosis. Despite his absence, his spirit remains vital to our organization's mission of providing divine sustenance through nature nurturing. My husband N.S. Venkatakrishnan, co-founder of Heavenly Fuel Private Limited, who is no more with us, had always motivated the Ayurveda doctors dive deep into research activities for clinical outcomes, which inspired us to go further pilot studies at Cancer Institute on one of our medicines. I would like to take a moment to highlight that we have been truly fortunate to have Dr. Mahadevan's guidance and mentorship to our projects, and his valuable guidance was a game changer to us. Now, under the expert formulation of the renowned Dr. Harikrishnan, we have dedicated ourselves to manufacturing authentic Ayurvedic medicines. But I feel our work must go beyond the pharmacy. To honor the memory of our dear Giridhar, we are launching a heartfelt project designed to walk alongside MS patients. Our purpose is to shine a light on the alternative therapies that can offer much needed relief to the patients. Helping patients navigate their journey with hope and live their lives to the fullest. The vision cannot be realized by one company alone. We need all your clinical expertise, your active participation, and your kind support. Today, I invite you to join us in turning this personal tragedy into a collective triumph for humanity. So let us join together to implement effective Ayurvedic management for this deadly disorder. Thank you, and I will now hand over to Dr. Harikrishnan. Thank you so much.
Thank you, ma'am. Respected doctors, a very good evening to all of you. We all have assembled here today to discuss about multiple sclerosis. At the outset, the tendency for all of us is to dive deep into the technicalities of diseases, and this is specifically applicable to diseases which are treatable by Ayurveda. We go into the Siddhanta and go into the clinical application. But when it comes to multiple sclerosis, we all have a particular point at which we stop the discussion and say that it is not curable and the prognosis is not very encouraging, and go to some other subject for discussion. But at the same time, beyond the technicalities of our system of medicine, it is also very important that we contribute for the patient's better quality of life by some means, through assimilation of good resources and good things from various other alternative therapies as well. In this regard, it is very apt to implement the concepts of Ayurveda's Nidana, that is to identify the factors which can help in alleviating at least some of the symptoms, following a diet and lifestyle accordingly. But before going into those areas, it is always better to listen about multiple sclerosis from the patient's own experience. So the first presentation, in fact, is going to be the patient's own words about what she had experienced with regards to multiple sclerosis. Now, I invite Ms. Vimuna Rangachari to share with us her experiences about multiple sclerosis. Ma'am, kindly unmute yourself.
It's muted. Yeah,
Yeah.
now it is. Now it is.
Yeah. Okay. So now I don't know. I'm not visible. I don't know why. Lalita ji, why am I not visible?
Yeah, we are able to see you, ma'am.
You're able to. Okay. I do want to tell you very briefly my journey. It's like a marriage. Okay. Multiple sclerosis for me, because now it has been plus 25 years since I've had multiple sclerosis. I'm 57 now. Okay. And I was diagnosed when I was around 35 something. Maybe I had it a little bit earlier. You know how multiple sclerosis is, right? I didn't go for a diagnosis. I just thought leg pain, this, that, and all that. But somehow I did get diagnosed. And I must say that in management of multiple sclerosis, I have been, in that sense, quite lucky because both my children were school going. They were not infants or, like not too small where they needed a lot of, basic physical support. They were school going children. But of course, it was a great, horrible thing for me because I couldn't go do certain things, which I had to accept. No, there's no way. See, there is no, in life, there are only two ways to handle life. One is you become a victim, or you try and overcome what you can. So I have been trying to overcome in various ways. And of course, I've had very good family support, all that. And for me, I would like to tell the doctors, especially meridian therapies, acupuncture, acupressure, and all these kinds of therapies have worked very well. Okay. And these are harmless because it's not even a medicine, no. It's kind of like a yoga thing only, right? I mean, certain points they press or whatever. So that has, I mean, in my experience, worked very well for me. And I'm still doing my own acupressure and yoga and diet. Of course, I have always been a little conscious about a healthy diet. Even before I had MS and all, I never used to indulge in junk and all that. And after that, more so. And I'm okay, sir. But I do have certain limitations. I have little pain in my, especially my shin bone area and all that. In a even surface, there's no problem. Like in my house or whatever, it's not a problem. But uneven surfaces up and down, and you know how India is. Sometimes it's a challenge, but it's handleable. Okay. And so what I do would like to tell everybody, all the doctors especially, is one is like doctor said before me, hope is something that doctors have next to God. I mean, only doctors can give next to God. Okay. So in my case, I was fortunate because even my doctor did not tell me that, you won't be able to do this, that, and all that. Of course, I did have challenges, but he did say that continue doing what you can and physically also have a physical routine, have some kind of yoga or anything which suits you. Walk, do not stop walking, be mobile, and also have a healthy diet. And plus, divert your mind because multiple sclerosis, if you go to the internet, there are so many theories and many people highlight. I mean, that is the world of today, where you highlight your challenges but not the victories. No, like for me, a small victory is climbing stairs without holding the railing. It may sound ridiculous, but for a patient, it's a great victory. So, and I'm able to do that. Again, as I said, mainly I would give a lot of credit to yoga only, because yoga, again, routine, regularity is very important. You all know that. I mean, you can't do yoga for one day and then just stop. Then nothing works. But if you do it regularly, I can observe myself that all the asanas I'm able to do better. And I will show you this something called magnet therapy also, which I do. See my finger. I put magnets on my finger. And I did put it also to show you all that this is doable. Everybody can do it. And anybody can do it with guidance. So what I do hope for is all the doctors come together. This this ailment can be solved only through that. Like Ayurveda, allopathy, Ayurveda, homeopathy, meridian therapies, all of them, if they come together, I am 100% sure that I'm not saying we'll become like PT Usha or some athlete and all that, but we'll be able to handle our life. And that's all. And that is what I wish to share. So, okay.
Thank you. Thank you so much for sharing your words about multiple sclerosis and how you are
thank you.
able to overcome it and what you are doing to overcome it.
See, I also, one more thing. I mean, apart from my family, I want to tell you also that I write for a magazine called Life Positive, and they have also been very supportive, as in very encouraging. See, what happens? I mean, not that I touch wood. I don't need to work to on my, like my husband is well employed. All that is fine, but mind is very, very powerful. So if I had not worked for if I did not had a professional commitment, I would have only thought about multiple sclerosis. No, and with the internet being what it is, I would have done more research, read more about it, got more depressed, got into a different kind of zone. Instead of that, doing something diverting your mind is the best therapy, which as an individual I can suggest. Even if you don't have a job, do something. I mean, everybody has a hobby. So do something, sing, paint, do something which is something. Mind cannot remain idle, no. Mind is a devil. So if you don't give it some activity, it will focus on your ailment only. So this is something, as I told you, sir, only a doctor can convince a patient. Because the patients listen to doctors. Like I will tell you my own doctor, no, neurologist, allopathic doctor. When I first was diagnosed, he was very, very kind, and he said, Jamuna, there is something which you will have to live with. And this is, I don't know when we'll be able to give you a cure or even a slight improvement in your condition. But what you can do is, he knows I like music. So he said, what you can do is listen to music, sing, divert your mind into that area. Do some physical activity, go walk, something like that. He told my husband also. I mean, we were kind of family friends also. So he knew us quite well. So he said that, whether or not you overcome it, make sure you don't obsess on it. And to the maximum extent, all of you, I would like to request you, please ask see again, mantras are part of Hinduism, and in fact, for everybody, prayers do help. So that is again a diversion, good diversion.
Thank you so much for sharing your words about your experience.
Hari, you are muted. We are not able to hear you.
Thank you so much, ma'am, for your sharing your experience. Now we have with us 3 different speakers for the day. And the first among them is Dr. D. Raghavendran, who is the consultant and clinical head at AVP Research Foundation, Coimbatore. He is here with us to share his experiences in treating multiple sclerosis. Over to you, sir.
Namaste. Good evening to all of you. Shri Guru Bhyo Namaha. See, multiple sclerosis, that is a topic which has been given to me to deliver, as this is the memory of the founder of Heavenly Figure, Sridharji's memory. This has been conducted. I thank the organizers and Dr. Hari Krishnan for inviting me to be part of this wonderful initiative to spread the knowledge to the other people. We tell in Ayurveda that Vidya Sambhasha Buddhi Vardhananam. When we share the clinical experience to others, that is the best way to integrate. Like how Madam Jamuna Madam told, there are so many things is available, but how we can share the knowledge. What is my experience? What is your experience? When we try to share, then we get more knowledge about how do we treat. So this is a wonderful opportunity. Thanks for the organizers to give me this platform. Coming to multiple sclerosis, of course, it's a modern terminology. In Ayurveda, we cannot find a disease which is similar to multiple sclerosis because it is something which is newly diagnosed. But in my clinical experience, when I have seen the patient from the age of 23 to 45, age between 23 to 45. 23, she was young, she was IT profession. She was unmarried. Even her condition was actually, I cannot say it is reversed, but as per Ayurveda, we consider that there are certain diseases which can be reversed, which cannot be reversed. In Ayurveda also, we have the concept of sadhya and asadhya. But still, there are so many factors which can give some kind of a sadhya nature also. It's not that completely we can say that multiple sclerosis cannot be cured. There are certain conditions, even though from modern perspective, we see it is an autoimmune disease which cannot be reversed, which cannot be cured, which can be maintained. But still, there are certain cases which we have seen that completely the lesion has disappeared and the patients are alive Yeah, she has got married, got children, she is living happily. So that was a positive area. But only thing is that, of course, everyone, each and individual is different. As per Ayurveda, we treat as per the many aspects like Prakriti or Vaya, because in her case, Vaya, the age was something which is uh, even the age of like Pitta Kala. So in present days, now recently I treated a case of 40 years multiple sclerosis. the, when we see about the Nidana, when I have gone through the modern literature, because as I told you in Ayurveda, we don't have the literature for multiple sclerosis. In modern medicine, they say about lot of autoimmune nature, they say inflammatory background, they say myelin sheet, they keep speaking. Okay. But from my way of understanding, I have seen that mostly the women are getting affected than the males. Okay. Comparatively, uh, uh, in olden days, it used to be like the proportion will be 1:2. If it is two female, one male. But nowadays, the proportion is 1:5. It is almost five female and one male. Maybe the proportion is keep increasing in the woman. And from Ayurvedic perspective, when I try to analyze, mostly we try to see the inflammatory kind of the changes are more in the woman. Like for example, the menstrual cycle, the hormonal kind of the changes, what is happening. So nowadays, everyone are with a fast life, with fast food and no time, no proper sleep, no proper rest, lot of stress. So factors can be multiple. In Ayurveda, we keep talking about ahara, vihara, and manasa, the food, lifestyle, and the stress. But in present days, how can we start seeing so much of people with this? Even when we are trying to go through, I was trying to search through how much people's in the world they are suffering from multiple sclerosis. Like globally, when we are trying to see, it is mostly in the European countries, American countries. So I have been traveling to many of the foreign countries where we can see that their way of the living was used to be a kind of not very good with the healthy eating. Not only the eating, if from the small age they will be put on into the contraceptive pills, lot of hormonal imbalances. Okay, so those all becomes one of the main what is it nidana when we are trying to see the hormonal imbalances are taken into pitta. As per Ayurveda, we try to think about the pitta imbalance in the body. So, pitta vada is the actual dosha when we are trying to think about the pathogenesis. Vada, we keep talking about vada disease as a multiple sclerosis, but it's not simple vada. Okay. Like we say that we try to treat with the avastha basis. We don't treat like multiple sclerosis. This is the medicine we cannot give. We cannot tell that this is the patient, this is the medicine. In Ayurveda, the concept will be completely different. So we try to see from the condition of ama condition, that is avarana condition, then entering into the kind of inflammatory condition where pitta is involved. Then it turns into a kind of the stage of vada where there is completely a degenerative phase. So the disease nature keeps changing. Like for example, some of the patient will develop only the weakness. Okay. Some of the patient will start with the vision imbalance. Okay. Impairment of the vision means in Ayurveda we say vision is pitta because it is the site of pitta. So when we say that pitta is involved, then we have to think inflammatory nature is coming in the background. When we tell there is a weakness is developed, then we have to think about vada because utsaha is the first function of the vada. Okay. Utsaha means enthusiasm. You have to be very active, very brisk. When you feel tired, extremely tired, that means your vada is not functioning properly. Either it can be avarana vada or it can be a shuddha vada. Avarana, how do we feel? Patients will develop swelling, edema, water accumulation, loss of appetite. So there are so much of the symptoms keeps varying from patient to patient that we need to analyze. We have to think about what can be the background of the problem. As I told you, we need to always evaluate the case to case, the treatment will vary. So we need to evaluate from first to last, how did they develop? what all can be the cause of the problem. What dosha would have got into the face? Either any other kind of the factor, like for example, when we always say in Ayurveda that Grahani Swabhava or Pandu Swabhava. That means there is a background of the disease which can lead to the other disease formation. So nutritional deficiency, nowadays we keep talking about the nutritional deficiency, which can be also a part of the cause, but not as direct cause, but which is a supportive cause. Okay. So these all inflammatory marker, like nowadays very important research happening upon the ILD, what's it, leukocytin, that 10, like cytokinin, all the inflammatory markers nowadays they keep talking. So only thing is when we talk about from the research perspective, there are so much thing we can talk, but in Ayurveda, our concept is very clear. We have very good kind of the philosophical, theoretical way of the explanation, but practically it is applicable. It depends upon the physician. How do we apply it to the patient? Okay. So this is the how we can think that how we can try to analyze. The nidanas is very important. We need to think about in humans, especially when I see a lot of symptoms, including the weakness, the muscle, what to say, the edema will be there. There will be a tingling sensation. They keep talking. Okay. These are the common symptoms. Treatment aspect, of course, we need to think about the dosha background. What are the, what's say, difficulty they have. But my treatment usually starts with the AMA basis. Background of the AMA will be usually taken because many of the patient, what we have seen, will have a edema or the swelling with the numbness. So there can be avarana background. We have to think about avarana. So if it is avarana, my first line of treatment goes with Udvartana. Okay. Even though it is a Vada Vyadhi, where Udvartana can increase Vada, but still, I feel that if it is avarana, we need to think about moving of the ama condition. Udvartana kind of the treatment, or Kadikili, like kind of Dhanyamla, Dara or Dhanyamla with kind of a Churna Pinda Sweda. That kind of the treatment, when we start initially, we think about removing the ama background. We try to think about cleaning the channels where the circulations can be improved. That will be the first line of treatment. Sometimes, in some cases, maybe Snehapana will be good because usually we think about the myelin sheet or anything like a Medo or Avarana or kind of a Majja Avarana when we are thinking. All these things are Sneha. What we are losing is the Sneha Bhava in the body. But initially, we cannot start with any Snehamsha to the treatment because of Avarana, Ama condition. So, of course, we keep talking about Deepana, Pachana, but it depends on the patient. It's not that everyone has to undergo the Deepana, Pachana measures, but external therapy, when we are trying to do, even when we start with Udvartana or Kadikali, this can help in removing the Ama or it can improve the circulations. And then later on, the Snehapana can be initiated. If you think maybe Churnavasti, some cases we give Churnavasti in the initial phase to clean the ama. Then we go for Snehapana. Snehapana is traditional way in North India they commonly do. In South India practice, they don't commonly do Snehapana as such. We go for more external oil application like Shirodhara or Pidachil, those kind of the treatments, which can be also considered as the Sneha Sweda kind of the measures. But again, it depends upon not only the procedure, what medicine we use, what dravya we use. I commonly use Prabhanjana Vimardana Tailam, Chinchadi Tailam, or Sahajaradi Tailam, Narayana Tailam. Those are all kind of a Taila. We cannot think only about the Brahmana. See, Brahmana alone is not the way of the treatment over here. As I told you, we have to keep thinking about Ama, Kaba background, Pitta background, then comes Vada. It's not that Kevala Vada alone we cannot think. But symptomatically, if the patient has lot of neurological weakness, wasting, all the kind of Vada aggravating factor, of course, we can think about adding Balashwagandhadi, Lakshadi Tailam or Dhanvandaram Gunambu. Brahmana kind of Taila also can be good. So depending upon the case, we can choose about what can be the external therapies. And then going for Virechana is very effective because usually for pitta background, inflammatory background, Virechana is good. But ending up the treatment with all kind of Brahmana line of treatment with the Mamsa, Pili, or kind of a Rajayabana Vasti. Even the Gridas, I use Gridas for the Vasti. Okay. Dadi Madi Gridam, Kalyanaka Gridam. Those kind of the Grida combination also will be used in case of Vasti. Even the Rajayabana Vasti, we go with the Mamsarasa Yukta. So those kind of the Brahmana line at the end as a Rasayana. Even internal medicine can be started with the Amrutotram or Rasna Panchagam Gashayam. It is very effective in case of Ama condition. Whereas later on going into Rasana Divgana Bhagam, which can be a kind of Brahmana Kashaya, Sahajaradi Kashayam, Prasarinyadi Kashayam is a very effective kind of the medicine. When we want to go into the very minute structures to nourish, then we can give Prasarinyadi Kashaya. So there are a lot of medicines, of course. We end up the treatment with Swarna medicines also, even like Swarna preparations, those things also will be good. Again, the limitation is in South India, we don't commonly use Rasa Aushadhi. There are a lot of very good Rasa medicines which is available, which can be more used in this condition. But still, I would like to just limit my talk to explain about how do we conceptually understand from the clinician point of view. I know that there are so many of the doctors who have joined, they are going to share their experience and their clinical conditions discussions. So this is how I try to manage the cases. Of course, the Patya plays the role, yoga plays the role, like Madam Jamna Madam told, multiple level of the management. We can integrate yoga, we can integrate diet, nidana, because we always talk about the nidana. But ahara alone is not the cause over here when we are talking about. We have to think little more wider way of thinking is required. So not only the vadahara, ahara will alone help. We have to think about pitta background also. But again, the final point I would like to add is the future of our practice will be more kind of a integrative medicine. Nowadays, I talk about integrative medicine because there are a lot of system which is coming up to include Ayurveda as part of the medical system in integrative approach where modern doctors and Ayurveda doctors, we work together. So we have to have a lot of evidence, a lot of publication is required. Of course, there are limitations as we are always involved in research. We know very well that our research are very much limited. There are a lot of restrictions, but let us hope that in future, even in multiple sclerosis, we will have multiple multiple centric way of the treatment where many systems comes together to work for the benefit of the patient. And I thank the organizers and Dr. Hari Krishna for giving the opportunity once again. Thank you all. If there are any discussion maybe in the later, I am ready to answer. Thank you.
Thank you. Thank you so much, Dr. Raghavendra. It was nice to hear you relating dosha and to the diet and relating pitta dosha with the prevalence of MS in more in female patients. And for all the participants, we can have the questions. We can type the questions on the chat window and we can discuss it towards the end of the program. We'll put forth the questions to the panel of speakers, and people from audience can also give their reply in case if they are ready to reply those queries by raising their hand. I also welcome Dr. Prashant Dharmarajan from All India Institute of Ayurveda. He has joined our meeting today. In fact, one of his students is going to present her research work as the third presenter today. So the second presenter for the day is Dr. Manju. Just a minute. Yeah. We take this opportunity to welcome Dr. Rai S. Sahayam Mary. She is the Senior Medical Officer at Sri Sharda Ayurvedic Hospital, Darsanagopal, Kanyakumari district, and she also is the student of Dr. L. Mahadevan. She is here to present her case, the cases which she treated as a case presentation. So over to you, Doctor.
Thank you, Dr. Hari. Good evening, everyone. With deep gratitude for my Guru Dr. L. Mahadevan's blessings, and the rich tradition I represent. I am delighted to share my work with this distinguished gathering. I would like to express my heartfelt gratitude to the organizers for providing me this valuable opportunity. I'm here to present a case study on multiple sclerosis, Ayurvedically Majjagadavadam, with Ayurvedic perspective. A 24-year-old male came to our OPD on May 2025 with a complaint of weakness in all four limbs, with imbalance in walking. He has been suffering for past 3 months. He has been diagnosed to have remission relapse multiple sclerosis and got treated from a neuro center. He had history of same episodes 2 years back, which recovered within a period of 2 months. Other associated symptoms like diplopia, fasciculation, slurred speech, urinary incontinence, generalized body pain, and fatigue were also present. On examination, he had no comorbidities. Cerebellar signs were negative, except for tandem walk and rhombox. Deep tendon reflexes were brisk. Upper limb and lower limb power was like 4+. All vitals were normal. MRI brain revealed tiny demyelinating lesions over bilateral cerebral hemisphere, brainstem, and cervical cord. Coming to Ayurvedic view, this affected Dhatvagni damages the Dhatus. Here we consider Majja Dhatu to get affected. So Vishama, we can consider this as Vishama Jwara, Chadurtaka Jwara. Treatment principles what we adopted. One Vishama Jwara Chikitsa, considering Majja Dhatu as Chadurtaka Jwara. And second, Kapha Avarana is there. Like the Kapha, it envelops the functions of Vada. Hence, Avarana Chikitsa was adopted. And considering the dosha as Vada and Pitta getting affected, Vada Pitta Shamana Chikitsa started with Tikta Rasa Prayogam. Once Pitta gets Shamana, then we need to treat Kevala Vada with Madhura Rasa. And considering later phase Dadukshaya, Rajekshma treatment was also adopted. At the end, Rasayana Chikitsa was given. Phase 1, internal medicines. We gave Pachanamridam Kashayam. As you all know, it is a Tiktarasa Yogam. Its Falasruti, it says Pakyam, Jvare, Padavyam, Pachanamridam. And along with Shaddaranam. Shaddaranam, like considering the Ama Avastha, it helps for Ama Pachanam. It acts on Amashaya Gadavadam. Chakradatta, he says, like it is for Ashta Mahagadavyadis. Externally, during phase 1, we did Udvartanam with Kola Kulatadi Churnam, followed by Churna Pinda Svedana. And on phase 2, internally, Ashtavarga Kashayam and Sagacharadi Kashayam, along with the Sagacharadi Thailam, Shamana Snegam was given. Like Stosham, Akshepam, Kampam, Stambam. Like in all movement disorders, we can go for Sagacharadi. This is from Dr. Mahadevan School of Thought. For both internal and external use, we selected that. And externally, Abhyangam with Sagacharadi Thailam and Patra Potala Svedanam was done during the first, second phase. Phase 3, internal medicine, Veerataradi Kashayam was given. Like all neurological conditions like weakness will be addressed with this. In Veerataradi Kashayam, Falasudi, it says it acts on Mudra Gatam. Considering bowel, urinary bladder incontinence to act on bladder, we selected this. Along with the Swadamshadi Gridam. Like doctor used to say, like Gridam, it helps to cross the blood-brain barrier. To act on brain, Gridam will be the good medium for medicine. And it is a Mamsa Bala Pradam also, it helps in fatigue. And during phase 3, we did Vasti procedures along with the external therapies also. For Matra Vasti, we selected Sahacharadi Thailam, and as a Yoga Vasti protocol, we did started with Eranta Muladi Madhu Dailika Vasti and ended with Mustadi Rajayapana Vasti. Mustadi Rajayapana Vasti has a major role in neurological conditions, and it is also Chakshushim also. So diplopia also will be addressed with this. Externally, Goduma, we boiled Goduma in Bala, Kshira Kashayam, and Big Pili, Mamsa Pili also we did. And phase 4, considering the Dadukshaya, Radhikshma treatment we adopted. In this phase, we did Jivantyadi Utsadanam externally, and internally we started giving this Varna Prayoga and all, Purna Chandrodayam, Siddha Magaradvajam also we added in this phase. And internally, we gave Rasna Dashamuladi Gridam. Like according to Dr. Mahadevan, he used to say this Rasna Dashamuladi Gridam, it's a Sampurna Yoga for multiple sclerosis. Like it's Palasuti says, no, Panjakasan, Shira Kampan, like Kampam, it refers to the tremors. Sarvanga Ekanga Rohamster, the imbalance will be addressed. Yoni Vamshana Vedana, Apana Vayu, urinary incontinence will be addressed. And in Rasana Dashamuladi Gridam, the Kalkam is Jeevaniya Ganam. So it is Chakshushyam, so it will help in diplopia also. And the other additional therapies, what we did Dara externally with Angamarda Prashamana Kshira Kashayam. Talam we did with Sahacharadi Thailam. And for speech, Pratisarana with the Saraswata Grida and honey we did. Nasyam with the Kshirabala Thailam. And Tarpanam for diplopia we did with Jeevaniya Gridam. Shirodhara with the Sahacharadi Thailam also were adopted along to the other treatments. And at the end, considering Rasayana, Lashuna Rasayanam was prescribed, Pundulegium from SKM Pharma with the Sahacharadi Thailam internally was given. And regarding Patyam, like advise the patient to avoid severe oily and deep fried foods. Panchagola Yavago in first phase, it helped to improve the Agni. And later, once Agni is improved, protein-rich diet with nuts and all was prescribed. On during discharge, so the medicines to continue at home, we gave Madhura Rasa Aushadas like Vidaryadi Kashayam and Nahabala Churnam with the honey, Purna Chandrodayam, Shayakulantaka Rasam, and Rasna Dashamuladi Gridam was continued. And we didn't go for Virachanam actually, we considered Daduk Sayam, Radha Ikshma, so Malam will be the Balam for the patient, so we didn't go for Virachanam. Directly we did Vasti. And overall, like fatigue, regarding fatigue, 80% improvement was seen, fatigue and pain. And in tremors, about 70% improvement was seen. And we have advised to continue Jeevantyadi Gridam as Anjana. And he's under regular Ayurvedic medication. The other techniques, what we added is like counseling techniques, we added like cognitive behavioral therapy, mindfulness techniques and all we adopted. Like in post-traumatic stress symptoms like depression and anxiety, they were addressed with the CBT techniques. Like reframing the negative thoughts process showed improvement in anxiety and depression. Mindfulness techniques like deep breathing techniques, motion techniques like yoga movements, it helped the patient to overcome fatigue and pain. And the patient is under regular medication till now. No further relapse is seen. And so my understanding, like multiple sclerosis of recent origin and a remission and relapse type, it can be well managed with Ayurveda. And remember, it is RPM. Whatever system, whatever techniques we apply, we can we can give them a healthy healthy lifespan. We can address all the fatigue, pain, imbalance, everything we can address. With this, I conclude. Sincere thanks to all the scholars and participants for your attentive presence. Whatever I have presented here today is a reflection of the tradition and wisdom passed down through Dr. L. Mahadevan. Thank you all once again for your time. Thank you.
Thank you so much, Dr. Raisa Mary. And it was as comprehensive as always. Mahadevan sir used to present right from the Samprapti up to diet and everything. It's the same presentation which we had heard you today. Again, any questions, please note it down. We'll go for the questions towards the end of the session. And now I would like to call upon the budding Ayurveda doctor from All India Institute of Ayurveda, Dr. Anaga Sudhir. She is here to present before us all the research work she has done with regards to multiple sclerosis. And without taking further time, I give it to you, doctor. You can start sharing your slide also.
Thank you, sir. First of all, I would like to thank my guide, Dr. Prashant Rajan sir, for giving me this opportunity. And definitely Heavenly Private Limited for giving me this platform to share my results of the study. So I will share my screen. Just a moment.
Yeah, I forgot to mention about her. She is the research scholar at Department of Panchakarma,
Yes.
All India Institute of Ayurveda. She is doing her final year. So rightly so, she is here to present before us her research findings. Over to you, doctor.
Yes, just a moment. I can. I'm sorry, sir. Can you see the PPT slide? If I'm
Are you able to share? I've given you.
there is.
She has to be made as co-host or.
Yeah, she's the host now.
But
are you logged in from mobile or laptop?
no, on laptop only.
Okay. Okay. Try it, sharing again. I just made one small adjustment.
So
Or if you can send the file over to me, I can share on your behalf. If that's okay.
yeah, sure. I think that would be fine because I'm unable to open it from here.
You can send via
Yes,
the
sir.
chat window, or maybe not chat window. You can WhatsApp me.
I can WhatsApp you. Yes. Okay. Sir, I have sent this PPT. Can you please
Yeah, go
check?
ahead. Yeah, go ahead, doctor.
Yes. So I'm Dr. Anaka from All India Institute of Ayurveda, final year PG, and this is my thesis study, and this was on multiple sclerosis. So this was done under the guidance of Dr. Prashant Dhanarajan sir, and co-guided by Dr. Anandraman sir and Dr. Aditya Dikshit sir. And this was a pilot study to evaluate the clinical efficacy of an Ayurvedic treatment module in the management of multiple sclerosis. So we have already got the introduction from Dr. Raghavendra sir and Roy ma'am, and the overall understanding is the same. And we have seen the Samprapti Vigatana, and accordingly we have planned the treatment protocol also. So the general introduction, we all know it's a chronic autoimmune disorder for the central nervous system, and it is characterized by inflammation, demyelination, and axonal damage. And it is also known as a disease of 1,000 faces. So focusing on the clinical manifestation is pretty difficult here because it differ according to the location of the lesions present in the brain. And it typically affects in the most productive age, that is between 20 to 40 years of age. The next slide, I think, can I change it from my side? Okay. So the estimated number of people with MS globally is 2.8 million, and the prevalence in India is increased from 1.33 per lakh to 8.35 per lakh in recent years. And India has witnessed a shift from being a low MS risk zone to a moderate one. And there are very few research work done, which are mostly case studies and some critical review. So there are no RCTs available till date, and we don't have a particular causative factor also. So we have to focus on more of the risk factors, which include the environmental factors, genetics, and some modified factors like low level vitamin D or tobacco exposures. So this is the pathophysiology, simply starting from immune activation, causing inflammation and resulting in demyelination. And it results in plaque formation, which causes the neurodegeneration. And this is the pathophysiology of MS. Now, as we can see that the clinical symptoms differ according to the topography of the lesions. So if it is present in optic nerve, the symptom is mononuclear painful vision loss. And if it is in spinal cord, there is hemiparesis, monoparesis, dysphagia, and urinary bladder dysfunction. And if it is present in brainstem and cerebellum, there would be diplopia, again, oxylopsy, vertigo, gait ataxia. And if it is present in cerebral hemisphere, there would be fatiobrachial crural hemiparesis and hemihyperesthesia also. So the symptoms differ as such, and these are the 5 types of MS: clinically isolated syndrome, radiologically isolated syndrome, relapsing re-emitting MS, secondary progressive MS, and primary progressive MS. So in clinically isolated syndrome, there is one MS attack we can see, but there is no multiple attacks, and there would be MRI findings of lesions also. In radiologically, the clinical symptoms won't be there, but we can see the MRI findings to be found in that there is lesion present. And again, relapsing remitting, there would be relapses and remission period in the course of the disease. In secondary progressive MS, there will be with or without relapse. There would be a gradual increase in the disease progression. And in primary progressive, there would be no relapse, but the disease progression would be increasing. So these are the conventional management that is available in today's era, and these include all these cortisone therapies and interferon therapies, and also some escalation therapies, which includes natalizumab and fingolimod and dimethyl fumarate. And in my study also, most of the patients were on dimethyl fumarate. And these are the side effects that we can see. And the patient who were on DMF had gastrointestinal side effects, hot flushes. So other than this, there were also some deranged values in their liver enzymes, their biochemical parameters, hematological parameters. So before treatment, we also had a look on that also. So considering the Chikitsa Sutra of Sarvangavata, we formulated this treatment module. So it included the Panchakarma therapies. Next slide. Yeah. So this overall treatment module covered most of the Panchakarma therapies. So considering, as sir also said, that we have involvement of kapha and we have involvement of pitta also. So starting from the avaran, if there is presence of avaran of kapha, we had to go for the Dipana Pachana and Rukshan therapies so as to bring the ama state to a nirama state and to continue it with the Shodhan procedure. So where we can also pacify the pitta through virechan. So we adopted a treatment module accordingly. So this is the assessment timeline. So we started it from Dipana Pachana for the Rukshan therapy, and we used Panchakol Churn. And then after obtaining the Samyak Pachana lection, we then moved to the Shodhananga Snehapana. And for Snehapana, we used Kalyanaka Grita. And after obtaining the Samyak lection of Snehapana, we proceeded with Virechan. And Virechan, we used Trivrit Avle and Draksha Fante Sanupana. And after completing Virechan, after completing the Shodhan, in the Brimhan stage, we opted for Patrapinda Svedan along with Nirgundi Tela and Shirodhara simultaneously, and for 7 days. And for the next 7 days, we adopted Shashtigashali Pinda Sweda along with Mustadi Apan Basti. And in the last stage, after the discharge of the patients, the completion, Shaman Aushadhis were given, and along with Pratimarsha Nasya was advised with Shirabala 101 Avarti. So the total duration of the study was 142 days, and every assessment was made after the Dipana, first before treatment, and then after the Virechan, and after completion of Basti, and then after the follow-up of 90 days. So these are the assessment parameters that we have used in the study: multiple sclerosis spasticity scale, visual analog scale for pain, EDSS score, and multiple sclerosis quality of life 54 instrument, and MRI for objective parameter. Coming to the result. So here you can see in the multiple sclerosis spasticity scale, we see a significant improvement after the viration and also after the follow-up. So there was good improvement, and the scores differed mostly during this period of time in case of spasticity. And these are all validated tools. In the next parameter, in EDS scale, again, this is a validated tool where we can see there was significant improvement after the Basti. So the patients who were having difficulty in walking had a significant improvement in their walking ability and losing the aids after the Basti were done. And also in pain also there was significant improvement, as we can see after the Basti also and after the follow-up. And between the viration and after the follow-up were seen a good improvement in the patient. So pain and increased muscle tension and bowel bladder incontinence are common symptoms that we see in a clinical setting when the MS patients usually come up with. And coming to the multiple sclerosis quality of life 54 instrument, so this scale combines both the mental aspect and the physical aspect. And in both the cases, there was good improvement after the treatment. So the BT after 83, which is the after the follow-up of 90 days, there were a significant improvement. These are the graphical representation of the results. So here also we can see there is a difference in the scores. I would like to share now some MRI reports of few patients. So this is one of the patient who, before treatment, we had the MRI in which we can see 5 lesions in the brain. So there we can see lesions over juxtacortical and near the ventricles also. So these MRI reports had gone through the McDonald criteria for the diagnosis of MS. And in the next slide, we can also see that the same patient have had lesions in the spine also. So there were 5 lesions in the brain and 5 lesions in the spine, and there were no enhancing lesions. And after the treatment, next we can see the after the treatment MRI report, where there were no signs of lesions in both the brain and the spine, which was quite a significant improvement in the patient. And in the next patient, so here also you can see there were no lesions. This is the second patient where here also we can see the lesions over the brain. And again, it fulfilled the McDonald criteria. And after the treatment, so the lesions were not enhancing, and also there were mild reduction in the degree of the lesions also. So this is the after treatment MRI report. And these are some AT and BT-AT result of the hematological parameters and biochemical parameters. The patients who were on dimethyl fumarate had a deranged liver enzyme values also. So here you can see that the SGPT and all had a very good improvement from the pre-treatment and also after the post-treatment. So we could also improve the side effects that has been caused by the conventional medicine that they were also taking side by side. These are the graphical representation of all the results. So here we have addressed the accumulation of AMA in the initial phase of AMA Pachan. So we had undertaken to advise Panchakol Churna to remove the avarana. And in the Shodhan. Next, we went for the Shodhan procedure, and subsequently we reached the Brahman Karma, followed by that, and the Shamana Chikitsa, which was designed based on the Dosha Avastha. And this, I would like to share a few videos of the patients also who has benefited from the treatment. You can play, sir. So the patient who had to get the support of a walker was able to walk by the end of the treatment without a supporting aid. In the next slide, we can go for the. So this is another patient who also had a difficulty in balancing and walking in straight line. So she had also had a very good improvement. And this is another patient again. And apart from the walking ability also, this patient also presented with diplopia. So after the treatment, the blurred vision was also improved. So they didn't have any kind of episodes of blurred visions afterwards. And all these patients are still in contact, still in follow-up, and there were no episode of any relapse until now. So that was a good thing because in every for every disease modifying therapy or for any treatment, we have to check for these few parameters whether this has been fulfilled to make sure that this treatment has worked or the treatment has been successful. So we need to see whether the MRI reports show no enhancing lesions, and if there is the frequency of relapse has been reduced, and also the disease progression has been stable or not enhanced, not increased also. So this pilot study demonstrated this Ayurvedic treatment module, including all these Dipan, Pachan, Virechan, Basti, Nasya, most of the Panchakarma, along with the Shaman Aushadhi. And it showed there was relief in symptoms such as in pain, spasm, fatigueness, weakness, and improvement in balancing of the body, as you have all seen in the videos also. And the patients were satisfied with the improvement of their quality of life, both physical and in mental aspects. And concluding with the thing that the sequential application of Shodhana followed by Brahmana and the Rasayana principles aligns with the Samprapti Vigatana, addressing both the root causes and the symptom relief. Thank you. And today we have high expectations for a successful MS treatment because so far we don't have a cure. But we also need to consider the fact that we have to stop the progression of the disease also. So this was a humble effort from our side to contribute in the field of multiple sclerosis through Ayurveda. And hopefully we'll come up with more research projects also in future. And let this be a pilot study could be helpful if it gets published also. So we are on the line of publishing this study also. So yes, thank you once again. Thank you, organizers, and thank you, sir.
Yeah, thank you so much, Dr. Nagasudin. So it was a very lucid presentation. You had done the slides very well and you have documented it very well. Thanks for the videos also and giving us a ray of hope for treating multiple sclerosis through Ayurveda, through Panchakarma. And still, if people have questions, they can type on the chat window and we'll discuss towards the end. We hope we'll have more such programs in future. We are also planning for frequent in meetings like this to have a thread. Let it be a thread, not just one-time affair. It will be a thread continuing the discussion and progressing further in terms of devising a plan or approaching and documenting it. Ultimately, our project objective is to give awareness booklets like thing to the patients and give them more resources And also sharing within doctors can also help patients to some extent. So in that way, we are aiming for a better future for those patients. Now, as a last part of the presentation, we have with us a recorded and translated version of Verma specialist from Kanyakumari. His audio, we have asked few questions to him and his audio was recorded, and then we translated it and we are going to present it before you. And
Namaste everyone. Mostly we see female patients for a multiple sclerosis condition. We had seen mostly the middle age group also. For females, the presentation was weakness and limited mobility of the limbs. We were able to clear it in 6 months and make them self-dependent and do the household work. Elder men, we had seen few patients, not to the extent of females. Females are the most common, but elder males above 60, 65 were also treated for the same condition. One of them had difficulty in writing, and gradually his walking was also affected, and that was cleared, and he was able to even self-drive a car, and he lived further 7-8 years, and then he attained natural death. And one more male patient who was above 60 was also treated, and we got good result in that. Though it was not complete, we got good result in that in terms of improving the mobility. He used to walk for a few steps, and then he used to lose balance and fall down, and his condition was corrected. He was able to walk better. And for a 6-year-old boy, he had tremor in his hands and legs, and that was cleared in about 8 months. And his speech was also not good, not correct, and his speech was also corrected in 8 months. So we are seeing patients even from 6 years of age, and most commonly at 35 years, middle-aged ladies, and also patients above 60 years of age. And what we need to note here is for elder people above age of 60, it takes more than 8 months for response, whereas younger the age, the response is better. For young age and middle age, the response is much earlier. Within 6 months, we get good encouraging results. For women at home above age of 60, we were able to make them self-dependent, go to the restroom on their own, do their household activities on their own, and in that way we were able to contribute for their self-dependence. For children, the observation is when we do treatment, Verma treatment for 2 months, we give a gap of 1 month, and then again we start for next 2 months. This is because we wanted to observe whether the positive results are happening for the child and plan the next schedule of treatment accordingly. When we observe the child, we ask for whether the child is able to recognize what we speak, whether the cognition has improved, whether the child is able to hear things properly, respond properly, basic orientation is good. When these things start happening in the first phase, so these are the signs of early recovery. So that we find, and then we plan the treatment by leaving a gap of 1 month. For women, what we observe is they get electric shock like feeling, which mostly happens in the D7 to D12 segment of the spine, and it may also extend up to the tailbone. This we were able to treat effectively and get the patient out of this symptom. And we don't apply any oil to the patient over the head. We don't give any oil. We don't apply oil and do the treatment. We directly use Verma technique and apply the manipulation over the prescribed points on the head and some parts of the spine. We don't apply oil at all. So far, there has been no relapse in patients whomsoever were treated by Verma technique. I had follow-up with a few patients who had reported us for 2 years, and they were all doing the normal activity. and even they had referred other patients. So relapse I have not seen so far. In fact, some of the patients we lost touch with them, but overall the relapse has not happened through Varma treatment. So the patients usually complain initially that they appear to be normal, but internally they feel there is always a constant pain, muscle pain, weakness in muscle, stiffness. So when we hear these symptoms from the patient, we palpate and we track the veins. So the Varma specialists use the word veins here, probably they are trying to mean the nadi. And here what we observe is the thickness of that particular vein. So based on that, we decide the treatment and the kind of approach we need to follow. Usually, Varma therapists will very strict diet restrictions on patients, but I personally don't give strict diet guidelines. Basic diet restriction is based on the associated symptoms or other aspects in the blood report, and if at all any other organ, like for example if they have issues related to the urinary tract or respiratory tract, something like that, based on that I give diet restriction. As such, I don't give strong diet restriction for such patients because they will become further weak. Already they are weak, they have tiredness, and I don't want to give further diet restriction to weaken them further. Patients can take oil bath weekly once or twice based on their convenience, but usage of air conditioner is not restricted specifically, but definitely the temperature cannot be less than 26 degrees. No need for AC during cold seasons, but in summer not to go below 26 degrees. Ideal is 27-28 degrees. They can go for regular yoga exercise, whichever they can, based on their capacity, whichever. They need not exert themselves, whether it is yoga or going to gym or something which motivates them, but that should not go beyond their capacity. Maybe it can be a bit less than their usual capacity. But only thing is, while doing such things like yoga and exercise, but it's always advised, but specifically people who do yoga and exercise, they should avoid gaseous food items which increase vayu, because that can get locked in the nerve channels, and that can further worsen the chances of reducing the symptoms. So that's why we tell them to strictly avoid gaseous substances which increase vayu. So based on the physique of the patient's body, the symptoms, the order of recovery from the different symptoms happens. But what we have observed is usually pain reduces first, and then numbness, and the fatigue, it takes some time, it goes off or it reduces considerably in 1 to 2 months. That's what we have observed. Namaste everyone.
So that's what we had received from the Varma specialist, and now the session is open for discussion. So we would like to invite the participants to ask their questions on the chat window, or they can raise their hand and we can unmute them so that they can ask their question. So I have a doubt here. Dr. Anaga is here. So Dr. Anaga,
Yes, sir.
were you able to document any comorbidity in patients of multiple sclerosis? Why I'm asking this question is we hear that people with allergy and a different type of immune system issue are not susceptible to multiple sclerosis. They escape that. They say it is these allergies are actually protecting them from such issues.
Yes, sir.
Yeah, please go ahead.
Sir, as this was a thesis study, so we had a inclusion and exclusion criteria. So, hello.
Yeah.
So, in that we have excluded the patients who had severe systemic illness, which accompanied MS and made it worse, because since this protocol also included Shodhan therapy, so we wanted a good bulk, and most of the patients who enrolled were stool, and they had wasting of muscles, and I didn't find any allergic reactions or any systemic illness other than, or also no any adverse reaction while the treatment was going on also. So it wasn't recorded as such.
No, what I wanted to ask was whether there was a pattern in patients, like they didn't have allergy or they had allergy or something. Was this any?
No, sir. My sample size was around 15, and I didn't find any allergic reactions though in any patients. I mean, in the beginning of the disease course also.
Okay. So as a follow-up, did you give some Shamana Aushadas to patient as take-home medicines? What?
Yes, sir. In Shamana Aushadhi, we had Ashtavargam Kashayam, Balarishtam, Vatagajankushras for Rasayan, and we had Ashwagandha Churn also. And it was given for 1 month, and then later on it was stopped, and along with that Pratimarshan Asya was also given.
Okay. Pratimarshan Asya. Okay.
And Yograj Google was also there. Yograj Google was also there.
Okay. Just a second. Somebody has asked a question from the chat box. So that's a question. Should we give Raja Yakshma treatment to MS Sthaulya patient with Hina Bala and Hina Shakti? So this is what I wanted to ask actually. The patient has MS, but the patient is obese with all the classical features of weakness, fatigue, and all. So how to go about it? That's the question here. Can anyone of you can answer?
Yeah, I would like to pitch in here.
Okay.
When we are talking about obese, here obesity has to be clearly understood, whether it is a natural obesity or disease created. Like there are some kind of the patient who will develop a lot of ama in the body, where there can be a kind of Sthaulya representation kind of a feeling. It's like water accumulation. It cannot be considered as obesity. There are certain patients of MS who would have increased the weight because of steroid or any kind of the medicines. That also need to be considered here. When we think about the obesity, if it is natural, the overweight patient from the small age or before the disease development condition, then of course we can think about doing treatment over here with the Alamahara, Kapahara line of the treatment. But whereas when we think about the obesity which is developed after the treatment, like after the disease development or because of the steroid, here even though they will look obese, but internally the dhatu and all will be all in the shitila stage, like all kind of not in a proper developed tissue state. There the weakness will be more there. So if we are going for the level of the ama line of the treatment, the Shodhana line of the treatment, and clearing the channels, and then only we have to go for Rasayana therapy over here also. This is my opinion.
Yeah. But can Snehana be followed with the same intensity for a Sthaulya patient with MS? Because Snehana is again, it is going to increase the Sthaulya.
No, not at all. I differ in that topic, in that point, because in many of the cases, Snehapana causes weight reduction. In my clinical experience, I have seen that the patients are losing the weight with Snehapana. There are different Snehapana. We have Gugula Gridam, Varanadi Gridam. If we are thinking that the Grida which has to be used as per the condition, we can modify the medicines. There is no harm. I feel that we need to go for Snehapana. But again, as we always talk about Avastha basis, we have to think whether that is suiting the patient or not. So Agni Ama condition, if it is taken out, then of course even in the obesity patient, we may have to go for Snehapana, which may not increase the weight and which can help in improving the patient condition.
So this question was asked by Dr. Subbulakshmi. Yeah, so we mean to say that even if it is a Raja Yakshma treatment, the Sthaulya patient is not going to become further Stula because of the treatment. So if it is done in the right manner, focusing ama and the correct order. So that's
So
what
can I add
please.
on?
Yeah, please.
So if it's a if the patient is stool and abalwan, I think we can go for dhanyamla udvartana in for the initial pachana.
Okay.
So dhanyamla based utsadana can also be done. For example, in stool pramehi also. So if the patient is palwan, we after pachana we can do snehana. And in the study also, all our snehapana patients reduced weight. So.
Oh, good. Okay. So that's interesting to know that. So you mean to say that we can do the initial pachana and then go for snehapana in such cases?
Yes, sir. Yes, sir. So, this was just a study. That's why we limited it to just Deepan Pachan. Otherwise, we can go for various Rukshan therapies during the Amapachan period.
Okay. Right. So, thank you. So, next question is by Dr. Sophia Dufrin. So, what she is asking is, after follow-up, can we adopt Ritu Shodhana along with Shamana Aushadhis to prevent relapse? So, periodical Shodhana and Shamana, is it going to help in prevention of relapse?
Yes, sure. I think, I mean, definitely it can be done.
Okay.
So it is compulsory. Actually, as we say, it is a Yapya Vyadi. Already Dr. Roy ma'am also spoken. As per our Dr. L. Mahadevan sir, see, we have to give some kind of supportive care in these patients in the long run.
Okay.
Ritu Shodhana or a kind of a Panchakarma treatment in between. Like we usually from AVP side, we recommend at least yearly once the therapies and all, some kind of external therapies, because already the disease nature has developed in the body. So even though we try to the lesions disappear, for preventive purpose, maybe like a 3 years or 5 years, we recommend the patients to have some kind of recurrent panchakarma procedures. So as a preventive measure, it is always good to go for Ritu Shodhana or Shamana kind of Rasayana therapies. It is always advisable for the patients to continue.
Okay. So another question I wanted to ask Dr. Anaga. So were all the patients in your study taking modern drugs parallelly, or they had the choice of taking only Ayurveda? What was the inclusion criteria in you?
Sir, few of them were taking dimethyl fumarate, and others who didn't take, they were not on any medication from the beginning itself. And few patients wanted to keep a washout period because they were having a lot of problems as side effects. So they wanted to completely shift to the Ayurvedic treatment. So we had a washout period for that also, and then we continued the treatment. And during the treatment also, there were no complications we faced for the patient who didn't take afterwards. And those who were on medications were also on observation because one of our co-guide was an intensive care specialist. So he was also there to look over it.
So would you find any variation in the results between the people who took both and people who took only Ayurveda or something like that?
There was not much differentiation because the dose were also very less, and there were also different types of MS patient also there. So in relapsing remitting patient who had taken the medicine had better improvement as compared to the patient of a secondary progressive MS.
Okay. In this one more question, I would like to put it to Dr. Anaga.
Yes, sir.
Whether the patients were divided into different groups or it was like a single group, what was the study design you made the groups?
So there were it was a single group and it was a pilot study. So as the prevalence was very low, it was very difficult to get the patient under the inclusion criteria. So it was kept a single group study only.
Because even when we are trying to talk about the allopathy medications, they are like you told, there were some people who were on allopathy medication. There were some people who were not on medication and somebody who waited for washout period. So did you see any difference in those three categories? Like whatever you have seen, like I'm asking your personal opinion. How do you feel with your research study?
Sir, actually, we didn't compare as such because our focus was on getting the improvement from whatever the initial stage they were going through to a better
So your
stage.
study was mainly from baseline to endpoint
Yes, sir.
for
Yes,
the
sir.
total group.
Yes, sir.
So, Dr. Royce Devi Sahib, I have a question for you. So, to get the initial result, so how long did it take for getting observable changes in the patient?
For this particular patient now, it took at least 10 to 12 days. When we get a patient, like recent onset patients, it takes more time actually. We have to, like the other doctor said, we have like two issues, like they will be taking steroids. With that, the toxins will come. With the disease, Amavasta, they'll come. So both for few patients, like for him, we took only 12 days. For other cases with the MS, like we have seen with Dr. Mahadevan, like at least for 15 to 21 days, we have done earlier, like first phase. Amapachanam, it took this much time. So it depends, it differs with the patient. For this particular patient, it took 12 days.
Okay.
And doctor, I want to, like I need to add one thing. Like someone asked about this Ridu Shodhana, no?
Yeah.
Like Ridu Shodhana, it clears the toxins, and the main theme behind that is to preserve the Agni. Like either it is Kai Agni or Datva Agni, it helps to preserve it. It helps to keep in maintain healthy Agni. So that Agni will be like this relapse for relapse Shodhana, Ridu Shodhana. It helps actually. It prevents for the it will prevent for the relapse phases.
Okay. 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 So now I throw this question to all of you. Is there any pattern, like any Prakriti assessment or any SARA or some kind of body type assessment which can make one person more vulnerable to MS, or it is more common in this, or was this documented, Dr. Anaga, in your case, maybe because you have research work done on that?
Yes, sir. We did had assessment of Prakriti analysis also, and mostly they were Vata Pitta Prakriti, and since the prevalence was also seen in females, so most of the patients of mine were females only, and the higher dominance was in Prakriti, it was Vata Pitta, and there were also a patient who had this Kapha Avarana in the like in the starting of the course of the disease also. But the Prakriti was mostly Vata Pitta, and secondly, it was Vata Kapha.
Okay. So one of the participants had asked about asked a question. It's not related to this, but many patients are suffering from kidney-related problems. Have you developed a treatment protocol for kidney-related issues proactively or reactively? Okay, this is outside our topic of discussion today, but maybe we can have. We had done previous programs on this 2 years back, and we also have a product in our thing called Vrica Plus Forte. But we will have this topic discussed later on. We will stick on to this topic, multiple sclerosis, for today. We'll come back for this later on. We'll update you about this. Okay, so so regarding Vasti, is it like we say that Vasti is an important treatment in Ayurveda? It's a half treatment done in Ayurvedic principles. So is it like, can we plan this Vasti protocol once in 3 months or once in 6 months schedule or something like that for these patients, apart from the take-home medicine or interim gap Shamana Aushadhis? Is it like that? or we wait for the symptoms to relapse and then admit for patient for further full course treatment? Is it what is the way to go about it?
So that's what I have told. It's usually this is how we plan that. We try to advise the patient to have yearly once treatment, even though they develop the symptom or not.
Okay.
That we have to give the treatment to the patient. You see, we should not wait for the relapse to happen. We don't have to wait for that. We can do the, like Ritu Shodhana and all is a kind of a preventive way of the treatment or something to strengthen the system. The similar way, yearly once treatment at least for 3 to 5 years, depending upon the disease nature and all. It is what we advise. If the patient is having severe symptoms, then once in 6 months also we advise, but depends upon condition. But it is always advisable to have the treatments repeatedly for this kind of the diseases.
Okay. So we find this neurological disorders falling under Vata Vyadhi in our textual references. So we find Pakshagata patients we usually see a lot, and Pakshagata in the sense these patients from who have faced CVA, stroke, cerebral infarct, those patients. But is it a lot different from how we approach them, or is this something which we go deep? Because why I'm asking this question is this pathology in modern terms is very deep. It involves the myelin sheath damage due to inflammation, autoimmune mechanism. So our treatment methods or our approach can go that deep, or do we need not think about that or remain only seeing the lakshanas and treat it? That's a question, though it is a basic question, but still it keeps lurking in the mind because the commoner always asks this question. Any of you can answer, Dr. Anaga, or anybody in the audience can also answer this question. Can we dive that deep into treating a patient by considering the modern pathology?
We have to, as I actually, in my opinion, of course, nowadays patients comes with all the reports. With a pre-diagnosed condition, they come with. Nowadays, all the investigation, all the advanced technology gives support us. That is how Dr. L. Mahadevan sir also used to say us. It's not Ayurveda. We have to use the technology in our practice also and interpret through the Ayurveda way. So when we are trying to see stroke conditions and all, like we say about acute and chronic, like we have Chirakari and Ashukari kind of the diseases are there. So there are certain diseases which can be a kind of a chronic diseases, which is having a kind of a deeper dhatu involvement, and which is like in the stroke, the involvement of the similar dhatu, even though we see it's an acute condition and it involves a lesser pathology compared to the multiple sclerosis, which is a chronic pathology which involves more system actually here. So it requires little more attention from even Ayurvedic perspective, and of course symptomatic way of analysis is primary. In my practice, I use the investigation as a secondary tool. Primary tool is symptomatic analysis because that is how we should not dilute our way of the analysis from Ayurvedic perspective of thinking. Like we have seen, like many of us have spoken in the same language. We told about Ama, Avarana, or Kaba condition, Pitta. This and all cannot be given through the modern investigation method. This is our own analysis. This is how. Our way of analysis, of course, is very deep, but we need investigation also as a supportive measure. Both the pathologies have different way of the approach. Here we need a more deeper way of the treatment because of the deeper pathologies involved. This is my opinion.
Okay.
Sir, can I add on?
Yeah, please.
Yes, sir. Considering Vata Vyadhi too, the treatment is basically Sneha Sweda Samshodhan, Mridu Samshodhan. So after a Mridu Shodhan, Basti can be a good choice in both the cases. Here also in my study, we gave Mustadi Apan Basti. So in like after Shodhana or post Shuddhi, we can go for Basti. And the Mustadiapan Basti is Vatahar, it has Rasayan property and it is Brahman in nature. So we used Ajamams in there, and we had Mustadiapan Kalk and Mustadiapan Kwat, and also Mahamash Tel for the Sneha. And after the Basti only, we could see a good improvement in gait.
Okay.
So that is, I think, the amount was also kept as a 600 to 650 ml range also. So it was safe and sound for the patient, and it did help. So after a Koshta Shodhan or a Mridu Shodhan, we can go for Basti. And it did give a good result in the study also.
Yeah. So we have with us Mr. N.S. Shivaraman, our co-founder's elder brother. So he wants to speak a few words. Please go ahead, sir.
Thank you, Dr. Hari. Can you hear me?
Yes, sir.
So first of all, I would like to thank the galaxy of doctors who have shared their experiences and also their eagerness to make sure that we have a future where the number of patients will be far less, and we can do something to even prevent up to the extent that we can. So I'm not a doctor, I'm an engineer, but I would like to share something with you. 2 days ago, I was attending a conference on the use of artificial intelligence on medicine. So there was a very senior professor from the SRM Institute of SRM Medical College. She was a professor and who is involved in a lot of clinical research. And she was narrating her experience, and she said they developed a vaccine for COVID in less than 18 months. Actually, the Covaxin SRM was part of the development. Second, they are also in advanced state of creating a cure for various types of cancer. The problem there was cancer. We know where all things, places cancer come, but we don't know how they are going to grow in the second stage or the third stage. What I wanted to request this galaxy of doctors is, what she said was very important. She said, forget about allopathy. In Ayurveda, that's what you're talking about. Our forefathers had identified 4,450 diseases. The number may be plus or minus a few. And she said they had cure for each and every one of those 4,400 odd diseases. Unfortunately, very unfortunately, it was not documented. So now we are again back to square one. We don't know what to do. Like, for example, my grandmother had some solutions which were not recorded at all. Like if you have a burn, she will apply an oil with some, plant in the backyard, and that white scar will never happen. And I had my own experience with that as my father. So my only request to all of you is, I think one of the things that will help you enormously is the use of artificial intelligence in collecting the data that is already available out in the world. Maybe some of you are already doing it. If that is the case, please excuse me for saying this. But I think if we can spend some time in picking up the published data or any other research anywhere in the world through AI, I think you will have a great starting point. So that you don't have to spend time on those aspects. You can use your brain on creating a cure for multiple sclerosis going forward. Thank you for your time and wish you all the best.
Thank you, sir. Thanks for your inputs.
Dr. Hari. You are muted, Dr. Hari.
Yeah, we have Dr. Chidambaram from Sri Sharda Ayurvedic Hospital, Darsanangopal. Just trying to connect to him. Chidambaram, doctor, please go ahead, sir. Please unmute yourself and go ahead, sir. Yes, sir.
Right. Bale. Bale. Mutulam. Okay.
Yes, sir.
Hello. I am not able to get my video.
Yes, sir. Okay, sir.
I have an opinion that this should be addressed by the toxicology also.
Okay.
Because it's like a Vega, it's coming and going.
Okay.
We should think of the Vesha Chikitsa in it. In my practice, I have done it with Kalyanaka Grida straight away. Because I suspected toxins in the system which had caused this problem. Because it was progressing. When the patient came to me, he was not able to swallow or speak, and it was a gradual one, and it started with the facial problem, then got into the tongue, and then the limbs. Then I straight away went to the treatment of, because Kalyanagradam has a multiple Balasurdi, and it can also remove the toxins and also give the mental balance to the system. Whereas Mahakalyana will be mostly, it will be of a nutritive nature, whereas pure Kalyanagadam will be of a some sort of apadarpana nature. And I have found result with this one. It's because it is Grida, it will straight away act on the brain. So it acted very well. Within a week, the patient got improvement. Then we have started regular medications with, of course, this Panchakarma and everything. And she was, this was a female patient. She got very well. She was studying and she passed the examinations, and that is a wonderful case. But I have seen a very good results, but just by the Kalyana Girda itself, because it gave me a very good start. We should also think about this usage.
Yes, sir. Sure. Point noted, sir. So, thank you so much, sir. Anybody else wants to make a point here can give their views. We are coming towards the end of the session today.
Yeah, I would like to add a point of Dr. Chidambaram sir's speech.
Yeah.
Actually, it is an excellent point raised by sir. Recently, we had a conference on integrative oncology in the cancer care.
Okay.
So this was also a brainstorm session where we were discussing about a lot of different nidanas. We keep talking about, like, even though we talk about Ayurveda, always Ahara, Vihara, and Manasa, there are so many things which we need to consider. Like, even in this class, I was speaking about hormonal imbalance, women taking contraceptive, those things are to consider. Now, the poison. See, there are so much things. It is not only the poison is related to only the poison what we take. Even microplastics, there are so many kind of the unknown food poisons which we try to consume in our diet. Also, there are a lot of kind of the preservatives as a poison. So there are certain things which all are part of our life which also aggravate the problem nowadays. Like autoimmune disease and all, we need to think in that perspective also. That's a very good point.
Thank you, doctor. Thanks for your opinion. So we'd like to go for the concluding session.
So I would like to add one more point regarding the AI also.
Yes,
the last week there was a talk, there was a discussion with Ayush. We have CCRAS, Central Council for Research in Ayurvedic Sciences. So there has been a meeting on AI, inducting of AI in our Ayush. So there has been Dr. Ramanohar, Dr. Somit Kumar, the researchers who all are very well involved in our Ayurvedic wing. They had a brainstorm session. There were so many things which has been taken up. Only thing is that we need to think of including AI in our Ayurvedic area. Is that Ayurveda always differs from rational thinking. As Sir told, like a literary review, those things, collecting, gathering the material, those things AI will do a lot of work. Whereas when we think about rational thinking, there are so much things which has to be done by human, and then incorporating the AI to
minimize all those gatherings to small points. Those things and all can be done by AI. This is my point.
Okay.
Yeah, I totally agree with you. What I was only trying to understand from the the invasion of AI and everything that we do in our lives, the time that we spend in looking for data from various sources from various countries can be minimized because that is already available. And then I think your brain can be used to put to better use because you guys are so brilliant, so capable. Why waste your time in looking at the data that is already available? That's all what the science. And human brain, particularly the brain of such good doctors, can never be replaced by AI. That's for sure. But you have the data available, which will help you to do even further. I want to wish you all the best.
Thank you, sir. And I would like to add just one point here. We have so different types of AI available now. And personally, I'm not trying to recommend anything, but my experience, I'm just telling the Perplexity AI is much better when compared to Google AI or ChatGPT. While asking doubts on Ayurveda, even deeper details about Ayurveda, Perplexity is scoring high. So I want you all to try that also and let me know how you found it. Right.
Hari, sorry, I'm getting interested in this. Sorry if I'm taking too long. But I think Arvind Srinivas, Perplexity, of course, from Chennai, he is one company which is growing so well because they are not into collecting revenue through advertisement or suggesting that you should go there. They are only giving the overall view without any personal influencing factors there. So you're right. Perplexity is a very good place to go.
Yeah. So we are going to do many such programs in near future. We wanted to positively make it happen once every month so that we have healthy discussions and share the Ayurvedic Shastra, Siddhanta, as well as clinical applications on a regular basis. And now we are concluding, and we really thank the participants here for patiently listening and giving their inputs, especially the speakers. They have really put their heart into this presentation, and they are doing so well. And the next presentation will be planning very soon, and we got a lot of registrations. Unfortunately, not all of them have joined today, but we got suggestions about what topics to include in the future. We'll also take that into account. And regarding MS, we want to do 1 or 2 more sessions so that we get a complete, make it complete and documented for the further usage for practitioners as well as patients. So once again, thank you all for joining us. Do take your time and visit our website. And also, you can always give your suggestions to improve our mission, which is nothing but to alleviate the suffering of mankind through Ayurveda with regards to chronic diseases and to act as an information center for healthcare. That's also an important part of our mission, to act as an information center. Once again, thank you, one and all.
Thank you, Hari. A great meeting. Thank you very much, and thank you, everyone. Yeah.
Yeah, thank you.